My name is Lauren, and I live in Port Dover right now with my mom and dad and my daughter Anastasia, who is 10 months old today. And I was introduced to the program through Midwest East Erie, actually. I knew nothing about it, but it ended up being the best decision I could have ever made.
The Norfolk Perinatal and Newborn Care Program is a partnership between the Grand Erie Public Health Unit, Norfolk General Hospital, and the Norfolk Family Health Team. So we are all about building community here and around the perinatal population.
We are obviously part of a rural community, and so at times access to healthcare in any capacity is limited.
We have a lot of newcomers, we have a lot of migrant workers, people coming into the community who aren't from here or new to the area in all sorts of different ways, just not even knowing what's out there or how to coordinate their care, which can lead to big gaps in cares.
My name is Dhruv and she is Pooja. So we are new in Canada, so we were not knowing how to refer to doctors and all. We tried to find the family doctor, but we failed for that. She was already pregnant, I guess, the fourth month when we came here.
And so we wanted to come together to kind of create a one-stop shop for all families in Norfolk County and surrounding areas, so that when they're having babies, they can just go to one spot and find all the services and care that they need.
One of the big projects that we worked on first started with prenatal classes.
We decided to come together, build the content for a collaborative 5-part series, and then teach those classes collaboratively. And so that's been a huge success, and that has continued on to this day.
Because of this partnership, clients are getting to hear from registered dietitians, from midwives, from public health nurses, from IBCLC, so internationally board certified lactation consultants. So they are getting much more targeted information, and it's specific to Norfolk County.
People feel safer, they feel heard, and also are happier with their care, feel empowered to make decisions for themselves.
This program is really helpful for us because, as we said, if we don't have a family doctor or something, we don't know where to go. And this is the perfect place for us, at least for the pregnancy, everything is good, and after the pregnancy too.
I was really, really impressed with the fact that they had, pre and postnatal care. The fact that when they came to the house when she was a newborn a few times, and the breastfeeding support, mental health support, we got pamphlets on pamphlets of information that we could reach out to if need be, and that just made me feel so comfortable.
Overall, we're seeing that clients in our community are getting more coordinated care. It's so much easier to send a referral, to shorten those wait times for clients, to be more aware of what's happening with our organizations.
When you start out with a culture of collaboration, you're much more willing and able to work with other organizations because you see the benefits on a day-to-day basis of that collaboration and how that helps patients.
One of the big things we did was perinatal symposium, where we were able to invite all the different perinatal caregivers in the community that we could think of. Doctors, midwives, public health, CAS, REACH, all sorts of programs, and just had a time for people to ask questions, present their programs, talk about the things that they do. So it was a really great networking opportunity.
I just find that I have learned so much from my colleagues that I'm working with, and I have a broader perspective of our healthcare system.
The other benefit, I think, is the increased building of community.
Knowing that I'm integrated into the community and meeting other ways. So that's been fantastic. And at the prenatal classes, I met a really good friend of mine, and she had her son a month after me, and we're still really good friends.
And I can tell you that they all want to connect and build a community, build themselves a village. So for me, that's always at the heart of what I do, is wanting to be able to start that for people, kind of bring that back so people don't have to feel like they're parenting alone.